student presenters, if I can get them. Can I get the students in? All right. I'd just like to recognize them for this incredible job they've been doing. I hope you had a chance to stop by and see the diversity of posters. This has been really amazing. Now that's a little glitch in the program. They should know that they should be here. But we'll wait until they come in. They're probably trying to get lunch too. Well, so in absentia, let's give them a hand for a fantastic job. And also, I'd like to recognize Dino and Prakash for a fantastic job. I think you'll all agree that this was really a great event so far, and we're looking forward. It's not over yet, but thank you. And it's my pleasure to introduce Gloria Waters for some remarks. Gloria, let me say a few words. Gloria is the Vice President and Associate Provost for Research at BU. But more importantly, she is a big advocate and a big fan for what the Hariri Institute is trying to do. I have worked with her for a few years, and it has been a pleasure. She is, what can I say, the best advocate I could have. And I'm amazed at the amount of work she has to do across the university. She's certainly beyond human. So, Gloria, thank you for everything you do on behalf of this community, which really needs the university to nurture it. And this is just the first, and I hope there'll be many more. And with that, I'll just turn it to you to give us some.
So it's wonderful to see everybody here today. So in terms of the things that I do at BU, this kind of event, this is what makes it all worthwhile, is seeing the faculty and students come out and having people actually discuss their research and work, as compared to worrying about compliance and rules and all those other things. We want to make research happen, but this is what it's all really about. So if you think about data science, I mean, there's just been this incredible explosion in the amount of data that is available over the past decade, for sure. And the field of data science has just exploded also. And as I first came into this position, and I worked with the president and provost to decide what are the areas that we're going to invest in at BU and what are the areas that we're really excellent in, data science really rose to the top of the list. And it is absolutely clear that we have world-class, fabulous faculty, both in the basic sciences behind data science. So we have faculty in math and statistics and computer science, electrical and computer engineering, and then faculty who do amazing work in applications of data science. And I think the work that you see with the posters here today and the talks that you're hearing about is just incredible evidence of the excellence and the depth of the work that's happening at BU. And one of the things that has been really a pleasure for me over the past couple of years is to work with the center directors in each of our research peaks and look at the ways in which they are really promoting work in their area and bringing the community together. And I think, when I first came into this position, the Photonics Center was a center that had managed to do that. But Ozzer has done an amazing job with the Hariri Institute over the past several years of bringing together a community of scholars and people who want to work together. When I come to the meetings of his advisory meetings and hear about the fellows of the Institute and the grants that he gives out and those sorts of things, I think it's really, really amazing to see what he has done with the Hariri Institute over the past several years. So as a result of data science being one of our peaks and areas that we really want to invest in, one of the things that the provost and I decided to do last year was to start what we call the Data Science Initiative. There are many aspects to it. An important part of it is that it's a hiring initiative to help us bring even more excellent faculty to here at BU. And Ozzer has been heading up an interdisciplinary team of faculty from across the various data science departments to help us find some faculty to add to the wonderful work that's happening here at BU. So I think, as I've been in this position, one of the things that I've learned is that faculty really are looking for opportunities to get together and to network and to hear about what each other is doing. And there's no better way of doing it than this. So Azar said to me that there were like 265 people who had registered for this. The number of student posters is totally amazing. And I think there's an incredible thirst for this kind of thing. So I want to congratulate Azar on doing this. I think it's terrific, and this absolutely does have to be an annual event. We need more of these things, and bringing faculty together. This is where all of the great new ideas come, networking happens, and new collaborations are made, and so it's terrific. So I really want to thank Azar for the idea behind doing this Data Science Day. There's no better way to highlight that this is a research peak and that we have excellent people doing excellent work in this area. And I also know that doing something like this is a lot of work. And so I especially want to thank him for putting together such an interdisciplinary team. So Dino and Prakash, it's great to have you participating in this and helping organize it. I think that's what makes this successful, is bringing together all these different people. And also the staff at the Hariri, Linda, does a terrific job of helping pull these things together. So it's really delightful to see you all here, and I hope that it's been stimulating so far, and I'm sure it will continue to be. So thanks.
Hello? Is this working? No?
This one is.
One is there will be a feedback survey that we send out, and we hope that you'll send us lots of ideas for next year, as well as suggestions for improvement, like more elbow room between seats. We will be posting the slides, and there will be a recording. We'll send out a notice about that. If you do not check in and get a name tag or your little nice data science thumb drive, please at one of the next breaks check in so we can keep track of exactly who came along. And again, thank you. We appreciate your keeping your belongings together. Although we obviously seem to have a little bit more room now, but there could be some more folks who walk in later. So thank you.
Thank you, Linda, and thank you again, Gloria. Truly, your support and the support of your office is critical to events like this, and we are extremely grateful. Another round of applause, please, for Gloria Walker. Okay, just to reiterate the panel guidelines, we will have 4 talks in quick succession, each 10 minutes long, followed by a 20 minutes question and answer period. We ask that all of you save all your questions, all your comments until the very end, after all 4 speakers have had a chance to speak. We also have Susan, who's sitting in the front row here, who's going to be the timekeeper for all of the speakers, keep everybody on schedule here. This next panel is on health, markets, and policy, and I would like to introduce our panel moderator for the day, for this panel, Stefano Monti, who is a professor of medicine and biostatistics at the BU School of Medicine, and he's going to introduce our panelists and moderate the question and answer period. So please, Professor Monti.
Thank you for having me here today. I'm very excited. It's a great turnout, great venue. I heard there was great food. I got here too late for enjoying that, but actually they saved some for me. But anyway, so I'm supposed to moderate this panel. I'm not sure how much there will be to moderate, because I'm sure that the speakers are top-notch and they will do a great job at conveying the essence of their research. And just let me remind you that actually it's going to be 10 minutes, as Dino pointed out. The questions will be at the end, at which point there will be the sparring, basically. So let's start with the first speaker, which is Evan Johnson, I just discovered that he'll get the office next to my office, so I better be nice to him. But I don't need to force myself. Evan Johnson is an associate professor of computational biomedicine and biostatistics, same as myself. And he does a great job at bridging the worlds of hardcore statistical modeling and actually data analysis, high throughput genomics data analysis. And so we look forward to hearing what he has to say.
Great. It's always great when you learn who your real friends are when they get up and introduce you and they have dirt on you and they don't reveal it. So it's great to know that Stefano is a great friend, and Stefano himself is a great data scientist as well. So it's great. So what I'd like to spend my 10 minutes talking about to you is focusing mostly on what I'd consider to be clinical data science, and just thinking of the whole idea is, can we use data, biological big data, to actually inform and influence how patients are treated actually in the clinic. And part of my motivation for doing this or being in this field is I have 2 teenage sons, and they get a kick out of walking around telling people, saying, my dad's a doctor, but not the kind that help people. And so I've made it my whole goal to do something that actually helps people, right? And so anyway, so the whole idea is, can we use biological big data to influence how patients are actually treated in the clinic? And so that's ultimately the focus. Before I go there, my collaborators and I have had a lot of experience in this area, biological big data, and I think data science. I think we're squarely in this realm. And so we actually recently wrote a kind of a commentary on some of the experiences we've had in this area, talking about some of the emerging phenotypes in data science, mostly in biology, but I think this is applicable everywhere. And these are phenotypes to avoid. You have the farmer, let's generate our tool or our data, and then figure out what to do with it. There's the gold miner, let's keep digging. Eventually we'll find what we're looking for, right? But you have to beware the allure of fool's gold in that case. There's the cowboy, shoot first, ask questions later, right? But it's only a matter of time before the sheriff hauls you off to the brig. There's the hermit, I don't need anybody else, right? And this is definitely a field where you can't do that, right? You actually do need to collaborate and work together. There's the master and the servant case. Did I slip? And that's, I saw this in a paper somewhere, or somebody else is doing this, let's find somebody, bring them in and have them do the analysis for us, for example. And that doesn't necessarily work. Collaboration really is important. And then there's the warden phenotype, and that phenotype is, the lock up your data, keep it to myself, so that I can benefit from it. And as it turns out, the data didn't do anything wrong, so there's no reason to keep them locked up, right? So ultimately, I'd love to talk my whole talk about this, but this is one area of commentary that we really like to think is that these are phenotypes to actually avoid. And we're actually trying to think about what are the good phenotypes that we should actually be working on. Definitely not this. And so, okay, so jumping back to the clinical story. So ultimately, motivated by my sons and their commentary on their dad, right? Dad can't ever succeed. And do anything. Ultimately, what we're trying to do is use these data to inform clinic. And for me, as a data scientist, success happens when the clinic is changed, right, based on what we do, the algorithms and tools that we've done. And this is one case, and again, I don't have time to really discuss it well, but this is one case where we actually found the genetic cause of a rare disease using DNA sequencing. And this family downstream now know the cause, and they actually can use current medical procedures to actually eradicate this genetic disease in their downstream posterity. So to me, that's a major success. There's other cases where we've taken and we've generated, based on gene expression values, generated drug efficacy signatures, and then taken those drugs and used them in different contexts. For example, this one example using the drug valproic acid, we actually, this is a drug that's approved for epilepsy, for treating patients with epilepsy, but there's been rumors that it had anti-cancer behavior as well. So we generated a signature, treated cells with this drug, generated a signature, and then projected it into cancer patients, and then tried to identify in which cases this might work. And now this drug is now in clinical trial, trying to be validated for use in this context. Another case, working again with DNA, trying to identify the causes of infectious diseases. So can we take DNA or RNA sequencing data from a sample, maybe from a patient's throat or somewhere else, and can we then detect which pathogen is actually causing disease? And again, like I said, for me, the payoff happens when you can actually translate that downstream. So we've actually spun off a company, for example, that is actually doing this and hands-on. We're not doing this in clinical or human subjects, but in agriculture context, we actually have customers that are actually paying us, believe it or not, to actually to help that in to pay for the services. So again, that's another major success, I think. Let me just spend the rest of my time talking about a case that, or a situation that we're working on right now, dealing with the evolution of tumors. Okay, so cancer, and basically how do tumors evolve based on treatment or selective pressures due to treatment. So, for example, many people know that cancers are not just one type of cell, but they're sort of a conglomeration of many different types of cells, represented maybe by the different colors. And then over time, those cells may evolve, they may change. As you give them drugs, you may eradicate part of the cancer, but maybe not others. And there are cases where, for example, you could be eradicating the wrong cells, for example, or you could be giving small doses of some sort of drug to one population that you're not going to eradicate, and it could actually adapt and actually become resistant to that drug. So the question is, how can we treat the cancer as a whole? As opposed to just maybe narrowly treating things based on a brighter, more select focus. So the whole idea is, can we collect multiple types of data? We're mostly focused on molecular types, but for example, DNA sequencing, RNA sequencing, epigenetics, proteomics, looking at single cell level, looking at multi-cell level, and then also we're moving into areas, how can we integrate imaging as well, so we can actually look at larger systems. I know this has been discussed, looking at multiple layers of these type of problems, and how can we then use that to impact how we treat cancer patients in the clinic. Of course, data integration is a major key focus, and this is one area where my lab and group has worked on substantially, is how do you normalize and integrate data across these different data types. Going back to this tumor subclone evolution, this is a collaboration with a group at the University of Utah and also in Australia. This is one case of a cancer patient where they began early on. We tracked and we tried to estimate basically the tumor subpopulations. And we did this based on DNA sequencing data where you looked for clusters of mutations that moved together over time, which could then try to help us to identify the different subpopulations within cellular populations within the tumor. This is one model of a patient that we actually monitored over time. And so you can see the little circles represent tumor clusters. The colored circles are tumor clusters, are mutation clusters that go through that travel through these populations. And then TAX and DOX and CARBO represent treatment regimes this patient was actually given. And we saw some of these populations drop out while others emerged. And in the end, this last population at the very far your right side, we actually noticed that was actually resistant to drugs, and in the end, this is what brought this patient to unfortunately her demise, because that population grew. And so basically our idea here is that, okay, we know what subpopulations we have, now can we then estimate what these populations are actually doing? So can we look at gene expression data, for example, and this is one model that we have, that basically models, and this is a factor analysis model that helps us to break down gene expression data to try to identify patterns and pathways that actually allow us to predict what's going on in these tumor cell populations over time. And this is just a few examples of actually cases where we actually could then use this to treat patients. Like, for example, this first plot up here represents apoptotic versus anti-apoptotic pathways that we could actually treat. And we actually showed that if we then gave a treatment, we actually treated anti-apoptosis, basically inhibited anti-apoptotic pathways, we could actually recover sensitivity to standard chemotherapies in this patient. And then we have a lot of additional work using single cell, using phenotypic level network type modeling. I know we had a whole session on this. And like I said, there's a lot of work to be done, and I think I'm out of time. So again, this is a major project with a lot of people and it takes a lot of effort and a lot of people to actually work on this type of project. Nobody can do all of this alone. So, and I think that's one key with data science as well, especially in biomedicine. So I'll leave that with the time because I think my time is far spent. So.
Thank you, Evan. So our next speaker is Ioannis Paschalidis, Professor of Electrical Engineering and Computer Engineering, System Engineering, and Director of the Center for Information Engineering and the College of Engineering. And we look forward to hear what you have to say.
All right, thank you. And it's a pleasure to be here. It's an exciting day. I learned a lot in the morning sessions. So I'll give you an overview of some of the work that we are doing in the area of predictive health analytics. And this is, I think, a slide with some interesting figures on the US healthcare system. And this picture here sort of indicates that the picture is not very rosy regarding the US healthcare system. So there's about 2.2 trillion that we spend roughly every year for healthcare in the US. This is way above what other countries spend. So compare, for instance, with OECD countries, we spend 2.5 more annually on healthcare. It's about 15.5% of the US GDP. A very significant part of this spending is spent in hospitals. So 31% of healthcare costs are hospital care. And in fact, a lot of this is probably unnecessary. There has been a study by the Agency for Healthcare Research and Quality fairly recently that suggested that there are about 4.4 million hospitalizations every year in the US that could have been prevented. And this amounts to roughly $30 billion, so $1 billion every year. About 30% of that, $9 billion, is due to hospitalizations that are related to heart conditions. And another 20%, about $6 billion, is due to hospitalizations that are related to complications from diabetes. So even if we consider these two diseases, chronic diseases, then there is a lot of potential for significantly reducing the amount spent in preventable hospitalizations. And this is not only, of course, an issue that relates to cost, because if we can prevent a hospitalization, then typically the prognosis for the patient is much better. So what can we do? The opportunity that is emerging is that now there is a lot of data available, both at the hospital in electronic health records, but also increasingly data that we own and we collect and use on an everyday basis. So if you think about your smartphone, your fit tracker, your smartwatch, collects data about your daily activities, your lifestyle, and this is data that could be useful in terms of making predictions about the future state of your health. And what I'm advocating, and I think what others are starting to realize, is that this is a golden opportunity for analytics to introduce a systems approach that devises algorithms, comes up with inference, facilitates decision-making, and eventually controlling your health in order to minimize the costs and to improve the quality. So one of the questions that we've started looking at is whether we can predict hospitalizations by using classification type of methods. And of course, prediction is the first step to prevention. If we can predict, then we can think about ways in which hospitalizations could be prevented. And from some work that we have done, one of the realizations was that, in fact, for every hospitalization and every patient, there are very few features that are actually indicate that future hospitalization. Even though the electronic health record has lots of information, there are very few features that inform us about a potential future hospitalization. So what is though complicating is that for every patient, these features could be very different. So in fact, there is no universal set of features that we could eliminate and look at those features in order to predict hospitalizations. So there are potentially clusters, and clustering is an approach that I think could be useful together with classification. And in fact, what we think is needed is some joint clustering and classification. There's a lot of interaction between clusters and then the classifiers that could be appropriate for every cluster. And this picture here gives you a sense of the type of the data that we are seeing in electronic health records. So you can think of, for instance, these blue squares as being individuals that are relatively healthy and therefore will not be predicted to be hospitalized in the very near future. And these are individuals that are unhealthy, that are likely to be hospitalized, but they have different underlying ailments that will lead to that hospitalization. So there are different clusters in this positive class that are emerging. And of course, if I knew these clusters, then I could very easily identify classifiers that separate this positive to be hospitalized class from the negative not to be hospitalized class. So in a method that we have developed, we call it an alternating clustering and classification method because it alternates between clustering and classification steps in an iterative manner. We use support vector machines, in fact, a sparse version of support vector machines as the underlying classifier. And we can prove interesting, beautiful, I would say, results that are mathematical results that provide guarantees on the performance of the method. But beyond the beauty of math, I think there are some real implications of this work. So we have worked with data that have been made available to us by the Boston Medical Center. And in this slide, I'll show you some results for hospitalizations that are due to heart conditions. So we worked with a data set that involves more than 45,000 patients that have been seen at BMC, and we have examined their record over a period of roughly 10 years since the time they started collecting electronic health records at BMC. And we are judging the performance of the various methods by what we call in our trade ROC curves. So these are receiver operating characteristics curves that come from radar theory. And what they do is they plot the detection rate, so versus the probability that someone will be correctly identified as being hospitalized versus the false alarm rate, which is the fraction of patients that we predict will be hospitalized and they are not. And instead of showing you these curves, I will show you a single number, and that number is the area under that curve and can be used to judge and compare different classifiers and different methods. So this is a table with some of the results. So ACC stands for the method we have developed, and you can see that it produces fairly good results in terms of AUC on the order of 80+%. You can think of this as a metric of accuracy. If you are interested in specific points on the ROC curve, then I would say that roughly 80–85% of detection rate with 20–25% of false alarm. What is interesting is that we compared these methods with methods that have been developed earlier that use risk factors that emerged out of the Framingham risk study. So that study uses a relatively small number of features, 5 or 6 features, and they have developed a 10-year risk factor for cardiovascular disease. And these classifiers that are using this small set of features are much weaker than the classifiers that we produce by looking at the totality of the electronic health record. So the take-home message is that looking at the whole electronic health record, which is only possible with an algorithmic type of approach, is very beneficial in terms of improving the strength of the predictions that we make. It's also interesting that we produce clusters of patients that are predicted to be hospitalized, and these clusters are actually quite informative, so they make medical sense. So these are, in this case, 5 clusters, and these are some of the peaks of conditions that are underlying patients in this cluster. So you can see heart failure, you can see ischemic heart disease, you can see dysrhythmias, arrhythmias, which are different types of heart disease, and therefore different features will be informative regarding future hospitalization and other types of heart disease. So this is actually very useful, because if I go to BMC today and I tell them I have the super duper algorithm that has an 80% accuracy, then it's very unlikely that a physician will use. But if together with a prediction I provide some additional information, this is why I think this patient will be hospitalized, then the likelihood of something like this being used is significantly increased. So I think my time is coming to an end. We have done work on other types of conditions, chronic conditions, diabetes. So I'll go very quickly. Actually, I will not spend time on diabetes. Feel free to talk to me later. So the results are similar. And again, the clusters that we are able to produce are quite informative in terms of the types of conditions that lead to hospitalizations that are due to diabetes. And we are actually now doing some work, and we have some preliminary initial results to predict rehospitalizations from surgery. This is a very important problem. They are interested in predicting 30-day readmissions from surgery, because if a patient gets readmitted within 30 days from surgery, then there are significant financial penalties to the hospital from Medicare and from insurers. So let me then come to an end and sort of describe with 2 titles some additional work that is being done in my group. We are working with the Brigham and Women's Hospital here in Boston in 2 projects. One involves medication dosage control in the ICU, post-cardiac surgery ICU. And we're also now started working with the Department of Radiology. This is in fact supported by the College of Engineering and the Department of Radiology at BWH. And we are looking in introducing safety measures to CAT scans. It turns out there are a lot of patients that undertake a CAT scan, and there is an overexposure because of malfunctioning in the machines, because the technician is not really very well informed about how to set up the machine. So we are interested in detecting these overexposures and prevent them. So with that, let me thank some of my collaborators. So these are students that are working with me and are here in the audience, and also collaborators at the various hospitals in the area. Thank you.
Thank you, Ioannis. The next speaker is Georgios Zervas, Assistant Professor of Marketing at the Questrom School of Business at BU, who's going to tell us about how to find good deals on Airbnb, I hope. Okay.
That's not the beginning. So, can I? Yeah, get it. Maybe we can go to slide 1, that'd be great. Thank you. Hi, everyone. This is joint work with John Byers from the Computer Science Department. Davide Proserpio, also from the Computer Science Department, who will be joining the Marketing Department at USC, and myself from the Marketing Department. And I think it sort of highlights the interdisciplinary nature of data science, which allows scientists from different communities to speak to each other. All right, so the work is about Airbnb and the sharing economy. The sharing economy, I have to speak to the mic, okay, is a collection of two-sided marketplaces that connect individual suppliers, non-professional usually, of various goods and services to consumers on the other side. These marketplaces now exist for various sectors of the economy. Interestingly, many of them, like transportation, finance, and accommodation, are both well-regulated and dominated by long-established firms. Airbnb is one of the most successful examples in the sharing economy and a pioneer. And this is the subject of our paper. So what does Airbnb look like? If you go to its website to find a good deal, you will find something that looks very much like a hotel website. In particular, you will see a picture of the room, the price per night. There are reviews and ratings, a bit like TripAdvisor if you use that. And then one unique feature of Airbnb is that together with the room, you get a host. In this case, Davide, my co-author, who is also a very successful Airbnb entrepreneur. How does Airbnb make money? Well, very simple. It charges approximately a 12% commission on every reservation. If you look at the actual reviews of Davide in this case, you will see that guests are usually very happy. Davide is not an exception. And they actually emphasize the personal aspect of Airbnb. So you will see that many of the reviews talk about Davide and Natalie, the hosts, rather than the room. Now, in this paper, we ask two questions. The first one is Airbnb creating purely incremental demand for tourism, or is it substituting away for certain hotel stays? And here I will show you that actually Airbnb is stealing away business from certain hotel types. Then you might ask, how is Airbnb different than hotels? Why are we studying Airbnb? More competition, less money for the incumbents. What I'm going to show you here is that because Airbnb can flexibly scale supply, room supply, during periods of peak demand, like let's say the World Cup or the Boston Marathon, hotel prices become less exorbitant. All right, so what do we know about Airbnb? There is a number of studies commissioned by Airbnb itself, which have a similar flavor to each other. They mostly emphasize the economic benefit that Airbnb brings to cities through the spending of Airbnb guests. Other than that, Airbnb claims that it mostly serves a different segment of consumers, that these are people who traveled because of Airbnb, and they're not substituting for hotels. Interestingly, hotel firms seem to agree. So Marriott's CEO, about 1 year ago, claimed that he thinks Airbnb is a really fun experiment, an interesting experiment that is very fun to watch. So let's take a look at the data. This is Austin, Texas, and this is 2008. Every blue dot on the map is a hotel, which has many rooms, and every red dot is an individual Airbnb room. So this is 2009, this is 2010, 11, 12, 13, 14. I do not have 15 here, but probably you can imagine what happens. This little gap here is actually UT Austin. It's not a bug in the data. Apparently, UT Austin students are not as entrepreneurial as NYU students, who I read rent out their rooms when they go back for weekends for approximately $200 a night on Airbnb. BU students, think about it. So, is that just an interesting experiment? Well, this interesting experiment has grown to approximately 1 million rooms worldwide, has served over 25 million guests, and has many other fun attributes like 600 castles. Because of this growth, Airbnb is currently valued at $20 billion, pretty much on par with the most successful hotel companies. Now you might say, Hilton and Marriott, these are companies that own real estate. They own rooms. What does Airbnb own? This valuation is, where does it come from? Let me remind you that actually, most hotels are franchised. So for instance, the Hampton Inn, which is a Hilton brand, Hilton owns approximately 0% of these rooms, right? So to study Airbnb, we collected data from the very friendly, actually, and very helpful Texas Controller, the agency in Texas that collects tax data. So we know for the past decade how much money every hotel made each month. I did not see that note. Thank you. There are approximately 4,000 hotels in Texas, and we know several attributes that you might imagine, what kind of hotel they are, and so on and so forth. We also collected data from the Airbnb website. Unlike the Texas Controller, Airbnb did not want to share data with us. We found approximately 14,000 unique Airbnb listings in Texas. We know their exact location, and we know their date of market entry, when they appeared on that map that I was showing you. All right, so to measure Airbnb's effect on hotels, I will tell you the cartoon version of our statistical analysis. We will exploit two sources of variation in the data. One is that even though Airbnb is very intense in cities like Austin, in other places, it's not there at all. By contrast, hotels almost uniformly cover the state of Texas. The other interesting source of variation is that Airbnb intensity varies over time as well as across cities. So there is a lot of Airbnb in Austin, and it has grown very fast, less so in bigger cities like Dallas and Houston. We put these two ingredients together in a so-called difference in differences strategies that compares the revenue of hotels in, let's call them high Airbnb cities, that would be the red line, with hotels in control, low Airbnb cities, over the same period of time. So in this case, we would be using the blue hotels to project the dotted counterfactual trend. The key challenge in any analysis like that is that something else might be happening at the same time that Airbnb is adopted that drives both Airbnb adoption and negatively impacts hotel revenue. We do many things in the paper to solve this problem, but since this is the data science day, I wanted to emphasize one aspect of this work. And that is to collect a lot more data to characterize these different locations in Texas and make sure that they look sort of approximately equal. So for instance, we collect data from the Bureau of Labor Statistics to get local unemployment and wage data. We link our data to the census to get population and demographic trends. We link our data to TripAdvisor so that we can control for changes in hotel quality. We link our data to the Bureau of Transportation Statistics to collect airline arrivals and passengers to control for different demand trends in the cities. And we even link our data to Smith Travel Research data, which is a travel research company, to basically account for hotel entry and exit. So what do we find? We find that a 10% increase in Airbnb decreases hotel revenue by approximately 0.4%. That sounds small, but this number should be interpreted in the context of Airbnb's growth, which is much bigger, which is very big. So in short, this translates to approximately an 8% decrease in hotel revenue in Austin, where Airbnb supply is highest. If you prefer the figure in dollars, for the average non-luxury hotels, this is approximately $200,000 a year. Another way to understand Airbnb's impact is to compare it with an equivalent increase in hotel room supply. And there we find that they're not quite perfect substitutes. So Airbnb has approximately 1/4 the effect that a corresponding increase in hotel room supply would have. And you also might wonder, where does this revenue impact come from? Is it a decrease in occupancy rates? Do fewer people stay in hotels? Or have hotels decreased their prices? Or a combination of both? And here we find that actually hotel prices are driving the effect, and they have dropped by approximately 5%. We also look at different types of hotels, and there we find what you might expect. Airbnb is more attractive for travelers that are less price sensitive. Sorry, it's less attractive for travelers who are less price sensitive and for business travelers. These are not amenities that Airbnb currently provides. So most of the effect we measure is concentrated in budget and economy hotels and hotels that do not have business facilities, although I think this might be changing. So let me conclude with one slide. So what's unique about Airbnb? The panel on my right shows you attendance in the South by Southwest conference, a very big conference that happens in Austin every March. South by Southwest is attended by many people, and they stay usually in hotels. This drives hotel prices up. And the more people that go to South by Southwest, the higher the prices. The panel on my left shows you changes in hotel prices in Austin in March, year over year. And you will see that following the economic crisis, prices have been increasing until approximately 2011, 2012, when Airbnb becomes really popular and prices start tapering off. And in the past few years, there has hardly been any increase. So I will stop here because I'm out of time, and thank you all for listening.
Thank you, Georgios. So now we have our last speaker of the panel, which is Dr. Michael Meurer, Abraham and Lillian Benton Scholar Professor of Law at Boston University. And we're all curious to hear what he has to tell us, since there is no title.
Thanks. Okay, I want to set expectations low by pointing to where I'm located in the university. So I hope you don't expect too much. One thing I'll tell you right off the bat is that I don't deal with big data, it's small data. I'll tell you at the end of my talk a little bit about the very few legal scholars that have projects that involve big data. So patent trolls. I hope you know from nursery rhymes that trolls hide under bridges and wait for merchants to pass over and then pop up and extort them. That's the reason why we have the label patent trolls and a lot of interest in the activities of parties like a firm called MPHJ. You might have heard about them in the news recently. They sent letters to 16,465 small businesses asking them to pay to MPHJ $1,000 per employee at these small businesses. So the basis for that demand was patents that are owned by MPHJ that supposedly read on scanner technology that's used to transmit documents via email. And I say supposedly because they've never actually taken any of these patents to court. They don't take the people that they send the letters to court, and it's very unlikely they would win any of these lawsuits. But a patent is a ticket into court, and it's a ticket that is cashed in very successfully by patent trolls. So as I became aware of this phenomena about 6 or 7 years ago, along with my colleague Jim Besson, we decided to take a look at the cost imposed on parties by the activities of these patent trolls. So the first thing that we noticed is that patent trolls account for about 2/3 of the patent lawsuits in the year 2015. If we go back to 2002, it was about 2%, and it has grown dramatically in the last 5 years. The trend looks similarly impressive, so that back around 90 through 99, when I looked into the data, I could only find a couple of troll lawsuits filed per year. And it's grown quite a bit up to 2011, continues accelerating in the last 3 or 4 years. So Jim and I, along with a student in one case, decided that we should try to measure the impact of patent troll litigation on defendants. And we decided to use 2 different approaches. First, we wanted to look via a survey at the direct costs associated with this litigation activity. And then second, we looked at total costs using stock market data. So the first approach, you can see here this is quite small. We did a survey with the assistance of a company called RPX of intellectual property lawyers in high-tech firms who are clients or are being courted by RPX. So the survey went to these lawyers and we asked them to provide information about troll lawsuits. I'll also use the term, and you'll see that in the slides, NPE, non-practicing entity. That term has a bit of significance here. The advantage when you bring a patent lawsuit, if you do not make anything, that is to say you do not practice, is that you are not vulnerable to a counterclaim by the defendant using their own patents. So when big commercial entities end up in a patent lawsuit, they often each are equipped with a portfolio of patents that they assert against each other. Strategically, it's better as a patent plaintiff not to do anything. You have very low discovery costs. When the other side asks you to produce documents, you have none. And when they try to counterclaim in a lawsuit against you, they can't stop you from doing anything because you do nothing but enforce patents. So we got a pretty good response rate, mainly because the people that we were asking questions in the survey had this business relationship with RPX, and they provided data to us about the direct costs of these NPE lawsuits, and we found that they were substantial, about $29 billion per year, where we extrapolate this to the entire population of these NPE lawsuits based on our sample. We're not so sure how representative this sample is, so we spent a lot of time fretting about that and looking for evidence that our respondents don't have higher than typical costs. And so I'll say a few words about that. So here's what some of the data looks like. So first thing that you should notice is that we can't disaggregate this data very far, but we were able to distinguish between small and large firms, between software firms and hardware firms. And we find that there are direct costs paid to outside lawyers. That's in the first column. The second column is licensing costs, what fees might be paid to settle one of these suits. And an interesting thing about those numbers is, as we expected, they become larger as firm size grows because the stakes are larger. People are willing to spend more in legal fees. And because if you were sued, the damages typically will be larger when your business is larger. So those both are consistent with what we see in terms of these numbers. And then we notice also that there's a difference between licensing fees with hardware versus software. We expect that is because design decisions tend to be more locked in with hardware products, so that it would be more difficult after a lawsuit to switch to an alternative design. So your bargaining power is going to be a bit less. We looked to help validate this data and convince ourselves that it was representative, looked at a couple of alternative sources that estimate the costs of defending against patent lawsuits. And we found the numbers in those other studies were comparable to what we found in ours. And then finally, we think it's important to note that there's a lot of skewness in this data that we expected to see. You can see that the means are about an order of magnitude larger than the medians, so that most of these suits are a nuisance, but we think for policy purposes, it's important to concentrate on the mean rather than the median. And as we're dealing with lawyers and policymakers, we want to warn them off thinking too much about their experience, which is probably going to conjure up numbers close to the median. We want them to be thinking about the means and try to educate them about the difference between those. The second study that we did it uses a technique that is extremely commonly used by financial economists. It's called an event study. The theory behind this analytic approach is that when a significant event occurs, investors will take note and stock prices adjust in response to that event. So our event is the filing of an NPE lawsuit. We had a little over 4,000 such events in the time period that we were looking at. And as I said, we tracked the stock market reaction. We took data from 3 different sources, so to the extent that there's anything interesting about the data here, we had to combine data, and my wife is a molecular biologist, and she hates the fact that we buy our data. She thinks that's just totally unfair. The data isn't entirely consistent. For example, that we don't have standard ways of naming these parties, so we have to do a little bit of matching of the parties across the different data sets. But we use CRISP data that measures day-by-day stock prices, CompuStat data that has characteristics of firms, and then litigation data from various sources, merge all that data, and we end up finding that there was a median loss in defendant share value between 0.3 0.3 and 0.5%, which translates into a $20 million median loss, an aggregate of $500 billion over that time period. That's not so interesting, as $83 billion per year in the later years of our study. So if you recall, the first study gave a figure of 29 billion. The second study gave a figure of 83 billion. Different methodologies, that's not surprising. What is more interesting, I guess, is that the second methodology, we think, is capturing more kinds of costs, is capturing both direct and indirect costs. And we think that the gap between these two is sensible. We think that the costs associated with patent litigation are actually largely costs associated with diverting manager and researcher time into socially unproductive activities. So some evidence that we think confirms that conjecture comes from an economist at Sloan named Catherine Tucker, who looked at a particular NPE assertion involving a company called Acacia. And she was able to do a difference in difference analysis where she had a group of an industry with half the firms being sued, half the firms not being sued, and also each of the firms selling both medical imaging software and text-based medical software. So across those four different categories and over time, she was able to tease out what she thinks is causal evidence of a significant 1/3 sales decline while lawsuits were pending, which she attributes to a decline in, actually the absence of innovation during the pendency of the lawsuit. So she thinks that she's finding very strong evidence of indirect costs associated with this NPE litigation, and there's much more to this story. In our research, we also look to what benefits might these NPE deliver, and at the end of the day, we try to count up the costs and benefits and figure out what an appropriate policy response would be to this activity. Thanks.
Okay, yes, I think we are supposed to sit there. So the speakers have spoken, and it attests actually to the broad set of topics that data science has covered these days. And so let me tell you basically that there are some, please, if you want to ask a question, please first introduce yourself, look for a microphone that I think will come your way, and then ask the question. And let's open the floor.
I have two questions. One for kind of related to the first two speakers, Evan and Ioannis. So in Evan's case, a lot of it was more mining the data and searching for some sequence that then may inform about a decision, a clinical decision, as opposed to developing a new analytic that combines data from different sources and drives the clinical decision. Whereas in Ioannis's case, it's taking the data and not searching for something, but developing an analytic. And I find that contrast very intriguing. Did I interpret that reasonably accurately?
Actually, so from my context, we do both, actually. And I think from that perspective, I think it's valuable to do both. I think of in those cases, developing new tools, developing new analytics, and then also just looking for things. I mean, I think the prior case that you mentioned that we're looking for, ultimately, yeah, if we can find that, then maybe we don't need new analytics. But in the end, that's rarely the case, I guess you could say. So we look first for the easy stuff and the low-hanging fruit, and then if that's not there, which it usually isn't, we move on to do something more sophisticated.
And in my case, I would say that indeed we are right now exploring existing data in the electronic health records. In some sense, the analytics are searching the data for the right features in order to make predictions. But I think it is quite interesting to also think about new sources of data. And I think the big elephant that is sort of coming down the road is the emergence and the ubiquity of personal health record data that if added to what the hospitals have, then they could lead to much stronger predictions at a much faster time scale that would enable much better action.
And just a quick follow-up. What's the last speaker? Isn't there a movement to make patent trolling illegal? And what's the status?
No, that's too strong of a statement. And it's too strong of a statement because there are entities that are called universities, or there are also entities that manage patent pools for standard-setting organizations that would fit into this category of non-practicing entities. So we see universities, for example, have very good reasons for not practicing their patents, and so we don't want to go too far in disabling non-practicing entities from asserting their patents. And so the many reforms that are being considered by Congress are targeted at specific practices that might give these non-practicing entities some kind of procedural advantage in litigation. And so if you bargain in the shadow of what might happen in the court and you change procedures that reduce their strength in court, then you might do better in bargaining with them, or they might simply decide this is no longer a profitable activity. That's unlikely to be the case. Generally, there's talk about reforming the patent system across the board, patents that aren't examined very carefully, that are overly broad, fuzzy, hidden, hard to understand, many different kinds of problems with the patent system.
Azar Stavros, computer science. It was actually very interesting to see the four of you and the diversity of how you got your data. So you buy it. You got it because we have a hospital, perhaps. But I'm actually intrigued with what Georgios did, which is he didn't buy it, and nobody gave it to him. He actually had to go get it. And it actually shows something else, which is about this big data issue. I was really intrigued with your point about you have to buy it. Maybe you don't have to buy it. Maybe there is a way to get a lot of the data you can use, and actually from going through big data to come up with the little data you need. So I'm actually just curious to talk about this intersection of, digging out the data which is out there versus other sources. It's just intriguing.
One thing that's clear is that people in law schools often don't have analytic skills, and a good thing to do would be to pair up with someone from another program that did. And so I know of examples of patent law scholars that pair with physicists to study networks of patent citations, or more typically, legal scholars pair with economists. But if you don't pair up with someone that can capture the data for you, then it's just sensible specialization is that I pay someone because I don't have the skills and I'm not about to acquire them. So, as an economist, I do like markets offering me a chance to buy things.
This is a shameless plug for the value of something like this, because the hope is that we connect the lawyers with the people who know how to do it. Georgios?
I guess one major source of one major source of innovation in making data more available comes actually from federal, state, and municipal authorities. So if you go to the website of your town, or if you go to the website of your state, you will actually find amazing data sources. And that's how we came about the Texas data, which is frankly fascinating. It's not in the best form ever. You need to do a bit of data cleaning. But generally, the people who assemble these data sources and want to make them open are super helpful, and they're happy that you use their data. So for us, over the past few years, it has been, I would say, transformative opportunity to add to the data that we collect on our own.
Let me say one real quick thing about that. Google made patent data searchable. So they actually struck a deal, and I think at no expense to taxpayers, they did what they do, and they turned these documents that were simply images into files that were searchable. So,
me add a comment about health-related data. So this brings another level of complication. Even though we do have a hospital, I had to go through 2 IRBs in order to get access to the data. But I think this opens the question of how do you share data that are extremely sensitive. And there are, of course, a lot of privacy issues, security issues. even data that are de-identified, and the data that we have access to are de-identified, it is possible, and has been quite a bit of work in this area, that if there are extreme values, you could potentially re-identify the data, and there are a lot of issues and danger in that domain. There are, I would say, some efforts now to share, in some sense, health data. There are companies that provide data, but again, it's not free. They expect that you will have research funding in order to support their operation of maintaining the data and of providing access to data to universities and to researchers.
For the Airbnb, can you talk about fake reviews, which is a big problem? You know, there are fake reviews posted, and NPR did several programs on, you know, how to sort of get rid of those kinds of biases.
Yeah, so that's an interesting question. So actually, reviews and reputation are a central part of the sharing economy, because you're not staying at the Hilton, you don't know what it is, you need to trust the person that you're staying with. Now, one good thing about Airbnb is that everyone who leaves a review has paid and stayed. So I cannot just decide right now that I'm going to write a fake review about your room and destroy your Airbnb reputation. A different problem that Airbnb seems to have is that people are just too nice. It seems that this personal interaction encourages people to speak more about the person. So, you know, if I find maybe a little bit of dust in my hotel room, I will go to TripAdvisor and complain. If I find a little bit of dust in my Airbnb host's room, but they're super nice and they greet me, maybe I will say that they were a nice person. So there is this different problem that Airbnb is trying to solve. But fake reviews do not seem to be a substantial issue right now in that aspect.
So I also have a question, kind of a meta question for probably many of you, and it has to do with actually the type of people or kind of researchers or scientists that you think are most best fit, basically, this type of work. And so I'll start with Evan and ask, do you think that it's more important to have someone that is very strong on statistics or very strong in actually computer science? Given that we're talking about data sciences and big data, which is basically often most of the work is about actually handling the data rather than doing sophisticated analysis. And I can ask the same to Ioannis and probably to Georgios as well. And this goes also to what departments would you look for trainees to work with, whether it's biostatistics or bioengineering and so forth?
Yeah, so interesting. So, because I've thought about this collaboration idea quite a bit, because it turns out my group and the research projects, we live and die based on collaborations, and we've had some collaborations that have worked really well, some collaborations that have worked really, really poorly. And I think the best way to interact and to integrate expertise is by identifying the fact that in my field, in statistics, for example, that's where my training actually is that what matters really is that you come up with the best method to do something. Whereas in biology, it's actually the first person to discover something that's important, right? And so, and sometimes the best and the first are not congruent with each other, right? And so identifying the ability to get a collaborator, get somebody who recognizes what I need, and I recognize what they need, we come up and be able to identify, okay, can I get what I need out of this? Can they get what they need out of it? And can we do something better even on top of that? But identifying those types of relationships, I think oftentimes are the most important key. And identifying people throughout through the spectrum. To answer, Stefano, your question exactly, I think the ability to really think outside of the box and outside of an individual discipline is actually the most important skill to have, because if you can integrate and interact with somebody, then you can always find somebody who has a specific expertise or in that area. So I think that's for me, that's what I look for when I'm looking to collaborate with someone with a different expertise.
So I think we can do one more question or have one more answer to that question.
Let me add a comment. In my case, the students I work with are fairly strong in terms of mathematical preparation. But I would say that My sort of perception is that the boundaries between disciplines are sort of becoming more shallow, and it's easy to communicate and collaborate. And we see that, I mean, this very event is an evidence to this. And there are disciplines that are, by definition, multidisciplinary, that encourage students that, yes, they have strong mathematical background, but they also have experiences in different application areas. So for instance, in engineering, we have division of systems engineering that brings students with such an interdisciplinary background. But we also need collaboration from people in the medical school to help us interpret what we see in the data and to help us interpret the results. And to my surprise, this has been easier than I thought it would be.
We are out of time? Yes. Okay, so basically let's thank again the speakers, and I encourage you to reach out to them if you have any other questions, and thank you for participating.
How old are your kids? So I have 4 kids actually. They're 15, 14, 10, and 7.